Peripheral neuropathy is nerve damage, most often caused by diabetes. Hence, it's also referred to as diabetic peripheral neuropathy. Diabetic neuropathy is caused by high blood glucose levels, which is known as hyperglycemia. Not all the reasons for diabetic neuropathy are understood, but it's understood that high blood sugar is the main cause, along with high blood fat, known as high triglyceride levels. Also, high blood pressure, especially in those that are overweight. It's believed that damage to the blood vessels causes decreased blood flow to the nerves. When this happens, the nerves are damaged due to a decreased oxygen level and nutrients. Blood vessels depend on normal nerve function, and nerves depend on adequate blood flow. Diabetic neuropathy affects all peripheral nerves, pain fibers, motor neurons, and autonomic nerves. Your entire body has nerves, therefore it can affect all organs and all systems. The nerves travel from your brain through your spinal cord, and they branch out to every part of you. The nerves control everything that you do, unconsciously and consciously. Diabetes is the leading cause of neuropathy in developed countries. 60 to 70% of people with diabetes have some form of diabetic neuropathy. The highest rates of neuropathy are in diabetics who have had the disease for over 25 years, although it can affect you at any stage of the disease. Some people with neuropathy have no symptoms at all, while most have numbness, tingling or pain in the feet. The feet are usually the first to show any sign of diabetic neuropathy because they're the longest nerves in the body, but it can affect any other part of your body also. There's many symptoms of diabetic neuropathy, such as numbness, tingling or pain in the toes, feet, hands, legs, arms and fingers, diarrhea or constipation, weakness, problems with urination, wasting of the muscles in the feet and the hands, nausea, vomiting or indigestion, erectile dysfunction in men and vaginal dryness in women, dizziness or fainting when standing up or sitting down, also autonomic neuropathy, which affects your internal organs, such as slowing digestion, slowing bowel and bladder emptying, which can lead to infections, impotence and vaginal dryness, excessive perspiration or very little perspiration. It can affect heart rate and breathing. It can cause high or low blood pressure and have many other damaging effects. You can help to prevent or slow diabetic neuropathy by keeping your blood sugar levels as close to normal as possible. This not only helps the nerves, but it also helps vascular disease. To test for diabetic neuropathy, your doctor will do a variety of tests. He'll do a comprehensive exam of your feet, because the feet are usually the first to be affected, and he'll assess skin, muscles, bone, circulation, and sensation. He'll use a monofilament line, something like a hairbrush or a toothbrush, to prick your feet to see if you sense the pressure. If you can't sense the pressure, it's a good sign that you've lost the ability to feel a cut, a bruise, a splinter, or any other damage. This places you at a high risk to develop an ulcer, which when untreated can lead to amputation. Treatment with glutathione, which is a free radical scavenger, is partially effective in the prevention of diabetic neuropathy, but it's of limited value when the neuropathy is already present. To increase glutathione, you can take reduced glutathione at up to 1,000 milligrams per day. You can take N-acetylcysteine at 500 milligrams 3 times per day. You want to ensure that you have your daily 200 micrograms of selenium. For example, one way you can get this is by eating 3 Brazil nuts. You can also take the herb milk thistle and eat asparagus. N-acetylcysteine which is broadly used for respiratory problems, was shown to significantly attenuate neuropathic pain through a unique mechanism of action. So it could be helpful here also, not just only in increasing glutathione levels, but for its other functions. CDP choline and its endogenous metabolites, cytidine and choline, promote the nerve regeneration, and they improve the function and the recovery of injured rat sciatic nerves. This could be beneficial for helping with diabetic neuropathy. Typical doses are 500 milligrams to 1000 milligrams per day. You can see my other video on choline sources for more information about choline. People suffering from diabetes often develop equally debilitating complications such as cardiovascular disease, retinopathy, nephropathy, and neuropathy, which are significant causes of increased morbidity and mortality among diabetic patients. Previous studies confirm that hyperglycemia has pro-oxidative and pro-inflammatory properties, which cause diabetes-related complications. So researchers have hypothesized that supplementing diabetic patients with fish oil, which is rich in omega-3 polyunsaturated fatty acids, might reduce the hyperglycemia-induced pathological changes due to the specific properties of the fish oil. Typical doses of omega-3 are 3 to 9 grams per day of an EPA-DHA fish oil blend. Vitamin B12 deficiency is highly prevalent, especially in patients with diabetic neuropathy. In a study, an inverse correlation was found between diabetic neuropathy and the blood levels of vitamin B12. Higher doses of the diabetic drug metformin and male sex hormones were also factors related to lowering levels of vitamin B12. It's important to realize that due to food fortification with folate, the B12 blood test can give a false reading and fail to detect a deficiency. You want to take either B12 injections for best results, or else take B12 in the form of methylcobalamin at 5,000 micrograms per day in a sublingual form. Vitamin B1, thiamine. A deficiency of thiamine causes beriberi, which is characterized by painful peripheral neuropathy and cardiomyopathy. Basic research has suggested that thiamine deficiency may also be involved in the etiology of diabetic neuropathy by preventing the glycation of nerve fibers as well as apoptosis of endothelial cells. Benphthiamine is the recommended form of thiamine for blood sugar problems, whereas the synthetic form sulbuthiamine is what's recommended for its effect on cognition. Typical doses of benphthiamine range from 300 to 600 milligrams per day. As it's water-soluble, excess gets excreted. Therefore, it's difficult to take too much thiamine. A new study has found that consuming garlic could help to reduce levels of blood sugar in people suffering from type 2 diabetes, as well as offering other benefits in the treatment of the metabolic condition. It can help to regulate blood glucose and potentially stop or lower the effects of some diabetic complications, as well as fighting infections, reducing cholesterol, and aiding in blood flow. Vitamin D deficiency and vitamin D insufficiency are associated with increased risk for painful diabetic neuropathy, according to a study published in Diabetes and Metabolism Research and Reviews. Previous studies have also reported an association between vitamin D deficiency and painless diabetic neuropathy also. You want to get a 25-hydroxy vitamin D blood test and then supplement accordingly with vitamin D3. Vitamin C plays a synergistic role in reducing pain in patients with diabetic neuropathy. You want to take vitamin C as liposomal vitamin C for best results. The next best form would be non-acidic, pH-buffered vitamin C, with the worst being cheap acidic vitamin C. Vitamin C's effect is enhanced when it's taken with flavonoids, and flavonoids inhibit various pathways that are involved in the progression of diabetic neuropathy, like the reduction of oxidative stress, the decrease in glycogenolysis, the increase in glucose utilization, the decrease in the formation of advanced glycation end products, and the inhibition of the alpha-glucosidase enzyme. This all indicates that they'd be a very good supplement to add to your recovery plan. The administration of chromium can reverse manifestations of severe neuropathy, nerve conduction abnormalities, and hyperglycemia. So chromium is an essential metal that plays a role in many metabolic processes and in maintaining homeostasis in the body. And vanadium seems to decrease blood sugar in people with type 2 diabetes. So these two combined could be a powerful formula to help with complications from diabetes. There's many cheap chromium and vanadium tablets available. Another substance whose benefits are enhanced when being taken with the flavonoids, a flavonoid like quercetin, is zinc. And zinc supplementation alleviates diabetic peripheral neuropathy by inhibiting oxidative stress and upregulating metallothionein in peripheral nerves of diabetic patients. Doses of zinc can be 30 to 50 milligrams per day, but be sure to choose a form with a high bioavailability. For the development of nerve repair, collagen is a good candidate, as it represents the major component of the extracellular matrix of the peripheral nervous system, and it supports cellular nerve function from development to adulthood. Doses of collagen can range anywhere from 5 grams up to 30 grams per day, and they can be derived from fish or animal sources. Sorbitol is a sugar alcohol. It was once widely accepted as a sugar alternative for diabetics. It's also produced in the body when glucose is metabolized. The dangers of sorbitol, however, have been in medical literature for over 20 years. Today, there's an increasing controversy over the merits of this popular sweetener. Sorbitol is osmolytically active, drawing water into the cells, and this causes the cells to swell, which can eventually result in serious diabetic complications, such as vision problems, known as retinopathy, nerve damage, known as neuropathy, and kidney problems, known as nephropathy, and also damage to blood vessels. Alpha-lipoic acid seems to delay or to reverse peripheral diabetic neuropathy through its multiple antioxidant properties. Treatment with alpha-lipoic acid increases reduced glutathione, an important endogenous antioxidant. In clinical trials, 600 milligrams of alpha-lipoic acid has been shown to improve neuropathic deficits. Doses can be as high as 600 milligrams taken 3 times per day, with higher doses being required by most diabetic patients. There's also compelling animal studies showing that a combination of alpha-lipoic acid with acetyl L-carnitine have life extension possibilities. Acetyl L-carnitine improves pain, nerve regeneration, and vibratory perception in patients with chronic diabetic neuropathy, an analysis of 2 randomized placebo-controlled trials showed. Typical doses are 1 gram taken 2 to 3 times per day. This supplement is also used to help to improve brain function. Berberine is a natural anti-diabetic substance. It can help to shuttle extra blood sugar to the muscles instead of depositing it as belly fat. It has similar action to the prescription diabetes drug metformin, also known as glucophage, but it doesn't have glucophage's associated side effects. It's also being investigated for its life extension purposes. You can see my other videos on the anabolic triad and on life extension for more information about this. Recent results indicate that berberine could remarkably improve the nerve conduction velocity. Using berberine to treat diabetic neuropathy in rats and in diabetic patients demonstrated that berberine could significantly improve the median nerve, perineal, in nerve conduction velocity. Typical doses are 500 milligrams taken 3 times per day in the form of berberine hydrochloride. The beneficial effects of magnesium treatment have also been shown to help patients suffering from neuropathic pain, such as in those with malignancy-related neurological symptoms, post-herpetic neuralgia, diabetic neuropathy, and chemotherapy-induced peripheral neuropathy. Sugar is known to deplete magnesium levels. In order to determine your dose, you want to slowly increase the magnesium until side effects such as stomach discomfort or diarrhea are noticed. Then slowly reduce the dose until you determine your maximum tolerable daily amount of magnesium. Many benefits may be noticed after a few months of supplementation due to magnesium's role in over 300 enzymes in the body. You want to make sure that you take magnesium in the form of magnesium bisglycinate. 2 separate recent studies on coenzyme Q10 were logged in medical journals, one in the US and the other in Iran. The Iranian study was undertaken to determine the possibility of increasing male fertility among those who were infertile. The US study in Miami, Florida, demonstrated a reduction of diabetic-induced neuropathy. Long-term, low-dose CoQ10 inhibited neuropathy-induced pain. From the study's notes, dorsal root ganglia, sciatic nerve, and spinal cord tissues from diabetic mice demonstrated increased lipid peroxidation that was reduced by CoQ10's treatment. CoQ10's administration was also noted to reduce the pro-inflammatory factors in the peripheral and the central nervous system. The study concluded that CoQ10 administration may represent a low-risk, high-reward strategy for preventing or treating diabetic neuropathy. Ubiquinol is the most absorbable form of CoQ10, up to 6 times better absorption than ubiquinone. Doses can be anywhere from 100 to 400 milligrams per day, depending on the condition. Vitamin K2 is directly involved in the health, growth, and repair of the nerve cells. Vitamin K2, in the form of MK7, is also helpful in energy production at the level of the mitochondria, which are the energy-creating batteries of your body, which are highly concentrated nervous tissues also. Vitamin K2 deficiency, as well as high blood sugar, directly and indirectly damage your mitochondrial batteries. A preliminary study has shown that vitamin K2 at a dose of 100 micrograms twice a day for 8 weeks was well tolerated and safe, with therapeutic activity for the symptoms of peripheral neuropathy. To learn more on the mitochondria, you can see my other video on supplements to boost mitochondrial function. Uridine, a building block naturally found in human breast milk, but now made synthetically as a supplement. It's been shown to improve things such as brain function, verbal fluency, mood disorders, and it increases the generation of new synapses, which could increase your IQ. A controlled, double-blind neurophysiological study using uridine versus a placebo in 40 diabetic patients with peripheral neuropathy had 20 subjects that were treated with uridine and 20 that were treated with the placebo. Evaluations were performed at baseline and after 60, 120 and 180 days of therapy, with a follow-up control after 90 days from the completion of the therapy. No statistically significant modifications were observed in the placebo group. In the drug group, however, the neurophysiological parameters improved significantly from the 120th day post-therapy compared with baseline, and they were maintained through to the follow-up. The authors discussed the results, which demonstrated that the treatment with uridine can bring about a neurophysiological improvement in the peripheral nerves. Typical doses can range from 1 to 2 grams per day in the form of uridine monophosphate. Its benefits on brain function are enhanced when it's combined with omega-3s and choline sources, as these are all necessary for the generation of new synapses. A team of researchers from the University of California, San Diego, found that cannabis had an amazing ability to greatly reduce and in some cases completely eliminate diabetic neuropathy pain, and all without the need for dangerous and typically ineffective pharmaceutical drugs. You want to check the legality of this in your country though. However, CBD tends to be legal in much more places than THC, and one study has shown that CBD kept chronic inflammation and neuropathic pain at bay, which tends to affect the hands and the feet of people with diabetes. You can see my other video on CBD and blood flow in the brain for more information on possible CBD uses and doses. Prevention is better than cure. Therefore, these sorts of complications can be avoided by changing your diet and your lifestyle early on before the problems develop. The more time that blood sugar goes uncontrolled, the more damage it can do and the harder it can be to reverse. However, don't lose hope if you're now only just realizing that you have a condition like this. There's still numerous supplements that have been proven to help, and it's never too late to make changes to your diet and exercise routine to help your symptoms. Be sure to check out my other videos on type 1 and type 2 diabetes for more information on ways to help improve your blood sugar levels.